Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Good afternoon. My name is Lesli Foster, and I am delighted to be your moderator this afternoon on behalf of the Black Women's Health Imperative and Healthy Women. We are really excited to welcome you to another episode of Reclaiming Your Wellness, Treatment Options, Access, and the Black Community. So for those of you who may be new to the campaign, welcome. We're glad to have you here today. This whole thing evolved around a conversation to raise awareness of obesity as a chronic disease and a national health crisis, I should say, in a manner that is free of stigma, of shame, and of judgment and bias. So why do we call this a national health crisis? Well, for one, over 94 million Americans of all ethnicities and ages are living with obesity just in this country. Obesity affects every aspect of the body, from the cardiovascular part of the body to diabetes, to strokes, liver disease, and so much more. So more than 2 in 3 women in this country are living with obesity. But we have to talk about how this impacts Black women too, because as we dig deeper into the numbers, we can see that that number rises to about 4 out of 5. This was a number we found back in 2018, and the CDC found that Black women were 50% more likely to have obesity than non-Hispanic white women. And then just 2 years later, in 2020, according to a study led by Harvard's T.H. Chan School of Public Health, the rate for obesity for Black American women had reached 59%. So clearly, that frames why we are calling this a national crisis. Over the past decade, science and the American Medical Association have recognized that obesity is a complex, chronic disease, and it really requires support to prevent and treat it like the chronic disease it is. So this afternoon, we're going to explore the why that this support behind this is so important. We're going to talk about why things like neighborhood design and environmentally safe access to healthy and affordable food and beverages and clean water and access to safe and convenient places for physical activity all have a major contribution to obesity. But I also want to add that access to knowledgeable and culturally sensitive healthcare providers is also important too. So we're going to weave all of that into this conversation this afternoon and talk about it, especially as it relates to the Black community. We are also presenting this webinar in conjunction with ObesityWeek 2021. So that's when leading international scientific conferences occur on obesity. This is ObesityWeek, and it gathers global experts together to really analyze this issue in an unparalleled level of obesity-related scientific information. And we've got a treat for you today. We've got 2 experts that are going to dig into this issue with us. First, we're fortunate to have with us Dr. Fatima Cody Stanford, a global expert who practices medicine at Massachusetts General Hospital. She teaches at Harvard Medical School. She is one of the first fellowship-trained obesity medicine physicians in the world. Not only is she an obesity physician who treats and cares for patients, but she's actually done more research on why obesity is so much more than just diet and exercise. And among her many accolades is that she was selected for the Obesity Society Clinician of the Year in 2020. So, the Obesity Society is the organization that developed Obesity Week. So we can talk a lot more with Dr. Stanford as we get into these critical issues, and we're so happy to have her here this afternoon. We also have with us, and are so privileged to have, Dr. Benjamin Chavis Jr., an entrepreneur, a global business leader, an educator, a chemist, civil rights leader, NAACP life member, syndicated columnist, theologian. He apparently does not sleep because he's also currently the president and the CEO of NNPA, the National Newspaper Publishers Association, which is the Black Press of America. And over the decades, Dr. Chavis has been a stalwart supporter of civil rights, and especially in the area of environmental justice. We know that our environment plays a major role in contributing to living with obesity, and it can have a significant influence on the options that we all have. So Dr. Chavis is going to help us explore that. And of course, to our audience, this really is all about you. So you can place your questions in the chat for us. We're going to get to as many of them once we get to that part of the program. We got a lot to get to and two incredible ambassadors and experts to talk about all of this. So let's get right into it. Dr. Stanford, we've been doing these obesity webinars for some time now. And the one thing we seem to notice quite a bit as we dig into this conversation is talking about obesity as a chronic disease. And yet we get feedback on social media from people who are questioning why we call this a chronic disease, and actually get even concerned about the way we're talking about obesity, right? Changing the lexicon, giving people their personhood. People are bristling at the changes that they're hearing and seeing as we talk broader about this as a national disease of concern. So let's talk about why obesity is classified as a chronic disease and why that is so important.
Absolutely. First of all, Lesli, it's a delight to be here with you. As always, I think you're phenomenal, and it's just great to be here with my fellow soarer. But let's get into this really important business, which is looking at obesity as a disease. And when we define something as a disease, we're defining it as a disease based upon it having pathophysiology. For those of you who aren't necessarily scientists, when we mean pathophysiology, how can we look in the body to discern how weight is regulated? So I always like to start off with recognizing that the most important organ that's regulating our weight, which defines how we look at obesity, is the brain. And there's a portion of the brain called the hypothalamus that is getting signals from different parts of your body, is getting signals from your fat tissue, from your large intestine, your small intestine, your pancreas, and your stomach, and sending signals back to your brain to tell you not only how much to eat, but how much to store. So when we're looking at a disease process, we can look inside the body, find different points and targets to determine why one person might be lean and another person might have obesity. So it's important for us to recognize that, because for so long we have really sought to, I guess, make people feel bad for their weight status, put all of the onus on them. It's all about what they are doing wrong. All they have to do is eat less or exercise more. And if they just do that, right, they can be exactly the weight they want to be. I think that all of us that are listening, hopefully today, know that that is not the way it works. It is so much more complex than that. And for those of you who really want to take a deep dive, I encourage you to listen to my lecture, Obesity, It's Much More Complex Than You Think, to learn about all of the parts of the body and all of the different reasons why one group may struggle with weight and another group or person does not. I think that's important. When we talk about the language we use, and Lesli's done a great job with think about the language we use with obesity. We've used this inflammatory language for so long. We call people obese. I want you to eliminate the word obese from your vocabulary. Obesity is a disease. A person has obesity. So you would say a person with obesity. And I think it's important because that changes it. You are not causing it. You have this disease. We have treatments. We have tools available, and we just have to utilize them. So I think this is important when we're thinking about this disease process regulated by the brain. We have tools. We know it's disproportionate impact on Black women. And that's why I'm dedicated to this work.
Clearly, though, there's a lot more work to be done on that, because there are people who are very resolute about the word obesity. And I think that gets to the stigma that's baked into this conversation.
Absolutely. You know, the stigma is so vast. And I think that when we look at stigma and bias, particularly in the United States, the two most common forms of stigma and bias that we see are race bias and stigma, followed very closely by weight bias and stigma. We have all of these judgments that we associate with people that have excess weight that come, and we actually begin, believe it or not, Leslie, to experience bias at starting at 32 months of age is when we really start to demonstrate that. That's really baked into what we're learning from our parents. What are our parents teaching us about people that have more size than others? And unfortunately, this plays out. So we see, you know, the issues on the playground where people are being called derogatory names because of their size, but it starts so early. And that bias we need to eliminate. The language is one way that we can begin to tackle this issue, but just learning about the disease itself is, I think, a really other important mechanism that we can utilize.
Dr. Stanford, you've talked about the myriad of issues that contribute to living with obesity. And Dr. Chavis, I know that you've had this on your radar for some time because back in 1983, you coined a term that is now part of our lexicon, which is environmental justice. And I'll tell you, the CDC says that neighborhood design, that access to healthy, affordable foods, beverages, a safe environment, the things we know now as the social determinants of health, all have an impact on obesity. Can you talk a little bit about this and how environmental justice plays a role in this now disease?
Well, thank you very much, Leslie. And I really want to thank also Dr. Stanford for her expertise and for sharing these details that really all African Americans and other people of color communities in particular really need to hear. It was back in 1982 and 1983 in Warren County, North Carolina, we discovered that they wanted to dump 40 tons of PCB, polychlorinated biphenyls, in an all-Black community, a rural community. And most of the people in that community got their water from wells. So by putting these cancer-causing substances in the community, it was discriminatory. And I coined the term environmental racism, and that's what led to the environmental justice movement. But to answer your question, Leslie, absolutely, it's connected. We have food deserts in our community where we're disproportionate, don't get the healthy foods. And as Dr. Stanford has said, that nutrition and other products, people who may have obesity, it's complex. It's not something simple. But I do think by getting the right information out, and that's where those of us in the National Black Press want to play a role with the Black women's health imperative to get this information out so we can make a difference. But environment does contribute to our wellness. I should say environment also contributes to our sickness. For example, in Harlem today, 60% of all the children in Harlem have asthma. They're not born with asthma. They get asthma because of poor air quality. So whether it's we need clean water, we need clean food, and we need clean air to breathe.
Dr. Chavis, I wonder, why has it taken us so long to connect the dots on this? I mean, it seems like common sense in a lot of ways, and yet you've been doing this work since the 80s, helping us to connect all of this and show how all of this is interconnected, and not just with obesity, in any number of chronic diseases.
Exactly. Well, the reason why it's taking so long, Leslie, is because there's so much misinformation out there, stereotypes. You know, we live in a digital media age, we live in a social media age. And I've run into tweets, Instagram posts, Facebook postings, and even sometimes on mainstream network television. People have misinformation and they think there's some simplistic solution to a complex problem. And that's why people are so disappointed with, you know, some of the diet programs or some of the exercise programs. They're only doing one thing and does not solve the problem. So what we need is comprehensive information to connect these dots. And that's why I really appreciate what the Black Women's Health Imperative is doing, is helping us to connect these dots. And then those of us in the Black press, our responsibility is to get that information out systematically, but also consistently, not just during a particular week that's dedicated to this disease, but every day, you know, 365 days a year, we need to be focused on wellness.
Let's drill down into that just a little bit more, Dr. Chavis, because I wonder, how do we fashion a message that is culturally sensitive and relevant and reaches us where we are in a way that stirs us with some urgency?
Thank you. I think the messaging should be uplifting, inspiring, and motivational and educational. So much of the messaging out there is sort of like a put down. It makes people ashamed. It makes people, even some people, look, in many of our communities, we have brothers who don't even want to go to the doctor because they don't want to be informed of the maladies. So we have to kind of flip the script with not only positive messaging, and I think your point about culturally sensitive, we need to see our images in a very positive way, and see the results of getting the proper information. I think this whole situation can be turned around, but it's going to take consistency. It's going to take a culturally relevant and culturally sensitive messaging, and also intergenerational messaging. This is not something just for people over 50 or for people over 40. It's intergenerational. And a lot of times, as Dr. Stanford is pointing out, this journey toward people who may be experiencing obesity starts at a very early age.
That's right. And Dr. Stanford, you talked about that. One of the other things I've learned through these many webinars, which has been insightful, is that the bias that we talk about also sometimes happens in the diagnosis of obesity, in the process of dealing with physicians. And so when Dr. Chavis talks about the messaging that needs to be culturally sensitive, we also need more physicians like you who are looking at the whole person to say, okay, now let's talk about who we are, who you are as a person on this journey.
That's extremely important. I really love all of Dr. Chavis's comments, to this point that really have honed in on how this is such a complex, multifactorial disease process. When I'm working with an individual patient, my goal is not to compare them to the patient that came before or after them. My goal is to compare them to themselves and find out all of the different reasons why they may have developed obesity. And then from that point, what I'm able to do is then tailor treatment to that individual. The person that I always tell them that's the most important person in the room at that time is not me as the physician. It's them. They are the star player and I am the coach, helping them to get to their happiest, healthiest weight for them. But it is intergenerational. It is complex. It is multifactorial. And taking a one-size-fits-all approach will lead to failure. And so that's what's extremely important. For the doctors that are out there, for the people that are aspiring doctors, we need more people on the ground doing this work. You can imagine that when we just talked about the prevalence of obesity, particularly for Black women, almost 60% of Black women have obesity. Who's there to care for these women? Who's there to make sure that they have a happier, healthier life? And unfortunately, there's so few and far between. We need more people that are dedicated to recognizing the complexity of this disease, ready to take action, ready to cure for the chronic disease state of obesity, and helping people to improve their lives. And that's what I've dedicated my life to, this work.
Can we talk about some of the innovations, some of the things that you talk to your patients about? And not everybody listening here is going to be able to see a Dr. Stanford, but they may be able to take the information that they hear and consult a physician who might be able to help them on their journey. So what kinds of innovations are you using now to help people with this chronic disease?
Yeah, absolutely. This is a great question because I think people think that they're going to go to the doctor. And this is probably what happens often is they go to the doctor and they're just told to eat less and exercise more. And they try to do that and their weight doesn't move and they get very frustrated. So we actually have things that actually work on the continuum of care that people need. Some people need behavioral therapy. That would be work with a dietitian or an exercise physiologist surrounding both diet and exercise. And that's great. That's one part of the issue. We now have a slew of medications that we can utilize for the chronic treatment of obesity. Just like you take a medication for high blood pressure or diabetes or other disease processes, we have chronic medications that can help change how the brain sees weight. And so that's really important to recognize that that's a tool that's going underutilized. I just published a paper that came out 48 hours ago in the Mayo Clinic Proceedings that shows that only 1% of the population that meets criteria for medications for obesity in the United States actually use them. 1%. That is dismal. We would be sued all over the place if we did that for diabetes or for high blood pressure or for even something like allergies. That is unacceptable with us having those tools and resources available. For those that have severe obesity, the best treatment by far is metabolic and bariatric surgery. So recognizing that that's a treatment tool that's underutilized. Only 2% of individuals that meet criteria for metabolic and bariatric surgery get access to that. So we are underutilizing treatments that are approved, evidence-based, that can lead to major sustainable changes in the lives of individuals. You can talk with your doctor. If you're not sure of who to even approach, you can look at the American Board of Obesity Medicine. There you can find over 4,000 board certified physicians in obesity medicine. And believe it or not, you don't have to log on. You can just look it up by city and state and find who's in your area that could provide you with this level of care.
You know, Dr. Chavis, what Dr. Stanford is saying are conversations that happen in her office. The kinds of conversations that you are fostering in the Black press are the kinds of conversations that reach people at their doorstep, at their kitchen table, in the living room, when they're at the family reunion. And so I wonder, how do we take what we're learning about obesity, put it into clear, digestible conversations that we can be having in publications like yours that really get to the heart of people? They trust what they're going to hear. How do we use that as a tool to build trust so that we can start to have these kinds of life-changing conversations?
Well, thank you very much. That's a very good question, Leslie. This year marks the 194th year of the Black Press of America. Since 1827, when Freedom Journal was first published in New York City, the Black press has not missed a beat, not only reporting the news, but been an advocate for improving the quality of life of our people. And certainly wellness is something. But I've been given some thought in preparation to today's panel. I would like to see, we have 230 African-American owned newspapers. And I'm pleased to tell you, Dr. Stanford and Leslie, that 50% of all of our publishers are Black women publishers, Black women entrepreneurs taking care of business in Houston and New York and Chicago and Los Angeles and other places, all the major places, including the South and Mississippi, Alabama, and Georgia and other states. But I think we should move subject matter of wellness toward the front page of our papers, and not sometimes you find health-related subjects in our papers near the end of our editions. I just think that this is so critical. One of the things we did when COVID hit, COVID-19, the pandemic, we had all these pre-existing conditions that made us more vulnerable to the COVID pandemic. And one of the things is, of course, people in our community living with obesity made them much more susceptible to the contagious COVID disease. But we have to re-educate our people constantly. So yes, I pledge to you, Leslie and Dr. Stanford, that we, the Black press, we want to continue to work with you. I think we should prioritize the messaging of wellness, prioritize the messaging of how to get more education about how to not only prevent the disease of obesity, but those who have it in the proportions that has been cited, almost 60%. What are the ways to mitigate against the continued growth and spread of this serious malady affecting our people?
Can I keep you here for just a second, Dr. Chavis, because you know there are some things about our community that have been passed down through the generations. We care for our families. Sometimes we put our own care on the back burner. We may not even think we are living with obesity because of the messages that we give ourselves and the generational messages that we have been fed through the generations. And so I wonder, how do we continue the messaging that you're talking about in a way that gets us to realize that this kind of self-care is about survival? It's not an option. It is life and death. It is the health of your family. It is the health of the next generation coming after you. How do we make this something where people say, today, I am going to do something because it's that important?
Well, I think the sense of urgency needs to be articulated. And I think that we should do it in a way, however, that doesn't make people feel like it's a hopeless situation. I do think that we can turn this around. Again, it's not just the quantity of the messaging, it's the quality of the messaging. It's how the message is presented. So we're not putting down soul food, but we're saying, listen, you have to be moderate for what you eat, and you have to make sure that what you eat is fresh. And I'm not a nutritionist, so I'm not going to start. I'm just giving an example that I think the details that come from physicians like and scholars like Dr. Stanford, we need that information to be put in layperson's terms so that the Black person can get it out consistently to our community. And we are trusted. We are the trusted voice of Black America, but we want to make sure that we are putting that information out about wellness. Keep in mind, it wasn't until the passage of Obamacare that we recognized that a lot of our brothers and sisters in the community didn't go to the doctor, period, until it was time to go to the emergency room because of the absence of healthcare insurance or the absence of having a primary physician. Some of that's changing, but not changing rapidly enough. So I think that, Leslie, we have to stress the sense of urgency around wellness, and particularly urgency around people and communities that are experiencing obesity.
So very important. Dr. Stanford, I want to ask you about this because a lot of people say, well, what's being done? What's being done about this issue outside just your doctor's office or outside of the messaging in the papers that Dr. Chavis is talking about? There is some legislation called the Treat and Reduce Obesity Act of 2021 that has been introduced in Congress. Can we talk to people about what this act addresses and how it may increase access to care?
Absolutely. So the Treat and Reduce Obesity Act that you've just spoken of is a bill that's been introduced before both the House and Senate. And believe it or not, we've been introducing this piece of legislation to Congress since 2013. So I just want you guys to get that through how long we've been trying to get this through. It does have strong bipartisan support in both the House and Senate, but we need it to pass. Let me explain what this bill covers. Number one, under Medicare, which we know mostly affects older adults, it covers behavioral therapy for obesity. That means work with a dietitian. Currently in the United States, you do not get to work with a dietitian and have that visit covered unless you have diabetes. So that means you have to get diabetes to be able to get that visit covered, which I think is very much backwards. I think we would want to cover you and get the proper education about eating before you get diabetes. And so our goal is to get that covered. And that's one of the key tenets of the Treat and Reduce Obesity Act. The second is coverage of anti-obesity medications, meaning medications used to treat obesity. Currently, under Medicare Part D, it is an exclusion, meaning anti-obesity medications are not covered for anyone under Medicare. That's problematic. Going back to that 1% of access in terms of who's using medications, a lot of it has to do with the fact that we just don't have the proper coverage of these medications. We know Medicare sets the stage for everyone else. Medicaid, it also sets the stage for private health insurers, those that are under employer-sponsored insurers. So if we can get that legislation to pass, which we've been trying to do every year since 2013, we open up access to work with dietitians and coverage of medications for the treatment of obesity. So that's the key messaging behind that. If you're interested in supporting it, I do recommend that you support it. All of the states are on board, but it hasn't made it across the finish line. And so we need more of a voice from the community pushing this across the finish line.
As this is going through that pipeline and the process, let's talk about some of the tools that we have accessed right now to help people understand their options for obesity treatment. So if we have people listening today, and I'm sure we do, who are trying to figure out how to navigate this journey, where do they start?
You know, one place that I really think is a great place for people that have obesity just wanting to get information is the Obesity Action Coalition. So the Obesity Action Coalition is a nonprofit organization dedicated just to patients that have obesity. Over 75,000 people are members of this organization, and they have freely accessible information that talk about all types of things related to obesity. What if you have a child that has obesity and you want to get them proper care? What if everyone in the family has issues with obesity? Where do I begin to look and navigate that space? So I think the OAC, which is the Obesity Action Coalition, is a great starting place. Also, if you want information about TROA and how can you get directly to your congressmen and women, your senators, to help push this legislation across, that's a really essential clearinghouse for information for persons with obesity. Obviously, you're here today, so the Black Women's Health Imperative is a wonderful tool and resource, providing webinars across the domain of looking at obesity care and access in your own community. I think a lot of it goes back to seeing who are the doctors on the ground doing this work, but not only who are the doctors, there's a whole slew of individuals that are doing this work, which include dietitians, bariatric surgeons, and many of us are on social media that are just looking to make sure that we educate using the right information, going back to what Dr. Chavis said, actual information from trusted sources. We want our voices to be out there. So Dr. Chavis, I think my goal particularly for the Black press is to make sure that our voices, those trusted voices, those trained voices, are getting out the best information about how to care for our people that have this disease of obesity. So those are some areas. I want to go back, of course, to remind you about the American Board of Obesity Medicine. If you're looking for a physician in your area, at the top of the page, you can say, find a physician, verify credentials, and look for someone in your city or state if you're looking for access to care.
Those are some great resources right there. And Dr. Chavis, I know you're part of an organization called the Healthcare Equality Network, and I wonder how that organization might also play a role.
Absolutely. The Healthcare Equality Network wants to work very closely with the Black Women's Health Imperative. I think, again, it's the consistency of getting the messaging out. And Dr. Stanford, I would like to invite you to consider being one of our columnists. We don't have a national column on wellness, and we certainly don't have a national column on people with obesity. So I think that as a result of this webinar, Leslie, I think we can kind of close ranks, work together, and figure out ways how to get this messaging out. And I believe there will be a very positive response from Black Americans to other communities of color once they get the information, and particularly in ways in which they not only trust it, but understand it and will take action. Sometimes people also need a call to action. After they hear the information, what is it they should be doing?
I had a feeling that this kind of family reunion was going to connect here as we were having this conversation, and I'm listening to both of you and what you are bringing to this conversation. We are, of course, in the middle of a pandemic. And while there may be some people who don't want to fully acknowledge that, the truth is it's still here. And the truth is the Black community has been disproportionately impacted by COVID-19, and living with obesity has been one of those comorbidities that has really taken so many loved ones from families, sadly. So can we talk about this again? If I know there are some people who may be living with obesity for whom that statistic or that realization is a very scary thing. Helping people understand that being on this journey of obesity and really having the tools to conquer this can save your life during a pandemic. There is a direct connection between losing folks to COVID-19 and living with obesity, Dr. Stanford.
You are speaking my language, and this is really why I just gave a recent TED Talk on what I call the collision of three pandemics. And those three pandemics are COVID-19, obesity, and racism. And when we look at what we've been dealing with in the most recent past, since really the start of 2020, it's been COVID-19. It's been dealing with the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, and all of the backlash that's come after that, and recognizing that obesity is the #1 risk factor for both sickness and death associated with COVID-19. So what do? I think the first thing that I would tell anyone that's listening, anyone that still may be hesitant, is to get vaccinated. We know that with a vaccination on board, that this significantly improves your chances of life in the midst of this pandemic that is very much still a part of our everyday existence. I know that there's been a lot of hesitancy. I've written a lot about this. I've talked with communities. I know there's some people that are moving into getting vaccinated because their employers are requiring it, but know that this is important. As someone who's fully vaccinated, I just got my booster actually just 2 weeks ago. I can tell you that you can be healthy, you can be safe, and this is the way to do it. Too many of our people are not choosing to be vaccinated, and we're continuing to lose people. We have crossed the threshold of losing over 750,000 people in the United States from COVID-19, but a vast majority are persons from underrepresented backgrounds, and the number one group affected, Black Americans. We can change the narrative. We can empower ourselves. We can get vaccinated. So I really encourage persons that have obesity, persons even without obesity, to recognize that the vaccine is something that's here. It's here to help us live our lives through this pandemic that has affected all of us. And so I really highly encourage that. And I think that's one way that we can shift the narrative, in addition to you recognizing that addressing obesity as a disease will improve your outcomes if you do happen to contract this virus.
Dr. Chavis, I know shifting narratives and pushing back on these ugly isms has been part of your life's work for years and years and years now. And I know as we talk about COVID-19 and we see how it has just decimated the Black community, what role are the publications that you represent right now? What role is the Black press playing in helping with some of this misinformation, some of this vaccine hesitancy to get members of our community vaccinated and save lives?
Well, when COVID first happened, the Black press, I'm so proud of the NNPA. We were the first national organization to declare a state of emergency for Black Americans. This was early on when there was not only hesitation, but people didn't believe the disease could affect us. There were so many myths. People were out there saying that people with melanin, if you had dark complexion, you couldn't get it, which was just absolutely false. And then, of course, people were comparing what happened to Tuskegee experiment, trying to bring that forward to today. And so we started our own NNPA coronavirus task force. We had Dr. Hilliard from Harvard Medical School, and he was on the FDA committee that approved the vaccine, to get information out. And when people found out, Leslie and Dr. Stanford, that it was a Black woman, Dr. Kezia Corbett, who helped develop the science that led to the vaccines being produced, I think people had a little bit more comfort. People saw it, and this is a problem with racism in America. I agree that COVID, racism, and obesity are these pandemics. But they're all interconnected. The tissues that interconnect these things. And I think our lifestyle, our worldview, the information, what we believe, what we don't believe. And so it puts a responsibility on those of us in the Black press. We try to make sure we keep people informed, but also keep people informed in a way that does not make them become cynical or hopeless or throw their hands up. I think the benefit of today's webinar is that once you get this information, you can change, you can protect yourself. You can also, if you are already experiencing obesity, there are ways to deal with that proactively and constructively. And I think we should never begin ourselves in a situation where we don't believe in the science. That's another thing. I think there's so many myths out there, particularly on social media, where even young people are engaging in conversations that are not science-based. The same people who are denying climate injustice are the same people that deny environmental injustice or racial injustice. It's all connected. So our role in the Black press is not only to connect these dots, but to make people be much more informed. And I'm an activist. I've come out of the civil rights movement. I think once we learn what the truth is, we got to act on it. And certainly this issue of challenging this disease of obesity within our community is something that we all have to rise to the occasion on.
We're going to be taking questions from the people who have joined us this afternoon, and we're so grateful for their time and so grateful for the questions that they're going to have for both of you. But Dr. Chavis, you said something there about action. And really, I think that's what these kinds of webinars are about, to empower you with information that helps you to take action to save your life, to reclaim your wellness. And so as we go into this question and answer session that we will share with the many people who have joined us today, I just ask, what's one thing that you hope people do having spent time with us today? And Dr. Chavis, I'll have you start, and Dr. Stanford, I'll
Yes.
have you finish as we go into the questions.
Well, one thing I want you to share with others, people who are watching this webinar, you're in the right place at the right time. However, I want to make sure that you share this information with people who are not on the webinar. We need to get this. It's just like a lot of times people are lamenting we didn't get out the vote as strong as we should have during this last election. Well, it's something we have to work at consistently. Don't wait till you have to go to the emergency room to get health care. Wellness is also preventative. And I think that the action that we have to take is to make sure that we spread the truth and the information and the science that's been given out on this webinar. Also, I would invite people to go to blackpressusa.com. That's our website. We cover a variety of subjects, including health-related subjects as well as wellness. And the information that Dr. Stanford gave out of those organizations that specifically deal with the disease of obesity, please go to those sites, get that information. I think, Leslie, knowing where to go to get the information is very important to people being able to take action on the information.
Dr. Stanford?
Yeah, absolutely. Well, I echo all of the things that Dr. Chavis just mentioned. But in addition, I just want people to leave recognizing that obesity is a disease. This is not anything for us to think of in a derogatory fashion. It's just to know that it's a disease that requires treatment. And we have those of us that are willing and dedicated and able to help you to live your best life. I think that's extremely important. This is not a hopeless situation. My patients go on to live very healthy and happy lives. That's number one. Number two, feel free to follow me on social media. I'm always doing lectures and interviews about obesity. And so you can follow me on LinkedIn, Twitter, Instagram at Ask Dr. Fatima. It's at the bottom of the screen. I am always seeking to educate individuals about obesity, about this disease, about how we have treatments and therapies that just aren't being utilized, and that we can make it better for everyone. So that's how I would kind of conclude my remarks before the questions, Leslie.
Dr. Chavis, real quick before we get to some questions, give us your handle as well, because we know you have many handles, but if people want to reach you to find out more.
Thank you. On Twitter and Instagram is Dr. Ben Chavis Jr. Dr. Ben Chavis Jr. You can reach me, and I do answer my own social media, so please hit me up.
Oh, he said, hit me up. All right.
Oh,
well, we know he's hip and he's out there if he's saying that for sure. He's saying that for sure. Here's a question that we get quite a bit, and that is, if you have a family member who you believe is living with obesity and you want to begin to have a conversation about how to help them reclaim their wellness in a way that doesn't ostracize them, in a way that it is free of stigma and bias, which are the very things that we're trying to achieve with this webinar series. How do you start that conversation? And Dr. Stanford, I'll have you and Dr. Chavis weigh in, because you both in your own respective careers have had to have some courageous conversations. And so I think it would be great to know, how do you start them?
So this is a really challenging question. So I'm going to, tread lightly. But I think the first thing is asking the individual if they would like to discuss, their weight and how it might be contributing to their health. You have to make sure that they're in a place that they're ready to receive information from you, or even have that conversation. And if they're not quite ready, then it's not the time to have the conversation. Even if you believe that the time is now, that person has to be ready. So make sure they feel comfortable and ready to talk about their weight. When and if they are ready to discuss their weight and how it has an impact on their health, then you can begin to give them resources and tools to teach them about things that can be done to better achieve a healthier weight status. For example, I wrote a book that you can find on Amazon. It's called Facing Overweight and Obesity, a complete guide for children and adults. And it goes over 400 pages of things that you can begin to think about and influences that have led us to the place that we are now, where we have these high rates of obesity within our communities. But number one, first ask if it's okay to have that conversation. And when you do begin that conversation, begin to offer tools and resources and offer yourself as a support structure. If you yourself have obesity and are having that conversation, maybe you can partner with that individual. Partners always help us to navigate this disease much easier.
Dr. Chavis?
Yes, I agree with Dr. Stanford. I would just say that one of the things I tell my editors and some of my editorial writers or journalists, write in a perspective that encourages people to take action, but don't judge people. I think people sometimes get turned off when they feel like somebody's judging them. So Dr. Stanford is right. It's how you approach your family members or loved ones or people you really care about. Having those conversations about wellness are so important. And even at my age, my colleagues in civil rights world, I'm always asking them, how you feeling? But, and if they're not feeling well, I try to give them some recommendation of who they should see to try to extend their situation. I think life is relatively short, and we should not be living our lives with diseases that could be prevented. We should not be living our lives with maladies that can be mitigated, but we need the right information from trusted sources. And I just think that what has been given out today is so invaluable. I hope we can repeat this webinar, Lesli, over and over again, place it on our websites at nnpa.org or blackpressusa.com so people can see this webinar over and over again. And Dr. Stanford, I'm getting your book.
Please do. Please do. I'll sign it for you.
Dr. Chavis, you are an activist at heart, and you learned early on, before the rest of us put the dots together, that environment plays a huge role here. I am in the Washington, D.C. area, where some of our neighbors who are in the most vulnerable positions are also in areas with food deserts,
yes,
with lack of access to care. You name it, it's happening. So how do we activate the activist in all of us to work to make sure that those of us who have the least have a shot at reclaiming their wellness too?
Exactly. Well, again, I think we have to, when we hear the term Black Lives Matter, it's just not about when somebody of a different race kills one of us, tragically, or we're suffering. And also it's about when we got to start treating each other better. We got to start caring for one another better. And I think that from an activist perspective, even those that are involved in some of the mobilization, I tell young brothers and sisters all the time, if you want to fight for freedom, you have to fight for freedom well. You just can't fight for freedom by, dragging yourself into a situation where you don't have good health. And these food deserts in Washington, D.C. is very serious. You have the nation's capital, and people don't have really access to quality food. So I do think that, Leslie, it's about how we articulate this issue. When I first learned about the webinar, and I said we're going to approach it for people who may be experiencing obesity, I was really thought about how can we do it in a way where people don't feel like we're trying to put them in a corner or judge them. But this is about embracing one another, caring for one another. And I think sometimes the conversations that we have, people can detect whether or not that conversation is a caring conversation or whether that conversation is a judgmental conversation. Mm-hmm. And I think that from the Black press perspective, we prefer to write in a way that makes people know that we want you to know this truth, but we also care about you. We want you to take care of yourself and use the information to impart to others who may not have the information ready at hand.
Yeah, I like that term, caring conversation. I think it's something that we should all embrace. It moves people in the spirit in which that you intend them to, which is for them to be their best selves and to be healthy, which is so very important. We've got a question here, Dr. Stanford, about sleep and the role that the lack of sleep may play in the disease of obesity and stress. much in the way that environment plays a role, whether you have access to healthcare and food. All of those things trickle down to your stress level, your cortisol levels, how well you're sleeping at night or not. I'm assuming that all of this is interconnected as well.
Yes. So I don't know who that person is, but I like the language you're speaking. Absolutely. Sleep and stress play huge roles. Let's look at sleep first, because that was the first thing that you brought up. When we have our sleep dysregulated, it affects those pathways of the brain that tell us to eat more and store more. So when we have that dysregulated sleep, it's actually influencing our brain to store more fat, believe it or not. So we want to really work on our sleep, not with just medications. A lot of people want to go on sleep medications, but many of the sleep medications like Ambien, Trazodone actually cause weight gain. People aren't aware of that. So be careful with just using something to really kind of architect your sleep, and try to do natural things. Number one, stopping screen time an hour before bedtime. That is all screens, including our phones, which we are, really kind of connected to, right? It's, connected at our hip. Making sure that you're eating, stopping your eating an hour, 2 hours prior to bedtime so that you can have more restful sleep, and setting a set sleep time that is consistent throughout the week, even on the weekends when we tend to want to sleep in. I think that that's important. But the more important piece that you brought up was stress. So stress is the number one reason I think that we have seen such a major rise in obesity, and particularly as Black individuals. When we experience either everyday or lifetime racism, you can imagine that stress goes up. Stress increases inflammation in the body. Whenever inflammation happens in the body goes into storage of fat, which means that if you experience racism every single day, the likelihood that you'll have obesity increases dramatically over someone that doesn't experience that. This accounts for some of the differences that we see in the rates of obesity within our community compared to other communities. So stress is extremely important. Now, we can't per se break down all of structural racism, but we can be a voice that helps to that dynamic, but we need our allies outside of our community to help play a role there too.
If you are a Black person in this country, stress is baked into your DNA. So we walk in the door already having that higher cortisol level just because of what you referenced, the daily stressors of life, the existence here. Dr. Chavis, this is your wheelhouse in terms of,
Yes.
our daily existence and the things that impact us differently than other Americans in this country. And so one of the questions that's come through here is really knowing all of this. What is your vision that the Black press can play in all of this and bringing it together?
Well, I believe that the Black press has a responsibility and an opportunity to help weigh in, particularly on the issue of people living with obesity, and also trying to prevent obesity from happening in the first place. I think that we need to make this a priority in the Black press, and I'm committing as the president and CEO of the NNPA that we're going to do that. But also, I would believe that we need more of the expertise that Dr. Stanford has really presented here in the day. We need to take charge of this. Stress. One of the things from a civil rights perspective, Leslie, we don't get stressed out in the civil rights movement. What we try to do is to take the stress that we would normally have and translate into something positive. It's our perspective. I mean, you can wake up in the morning and be stressed out. And some people don't even watch the news because they're so stressful. And that's where we bring balance. I think every human life needs to have balance. I don't think you can probably live a life without inner stress, but the question is, what is the balance to the stress? And when you fight for freedom, when you stand up and speak out, when I joined those brothers and sisters in North Carolina, when we formed the environmental justice movement, that was stress relief. That was therapeutic relief from the stress. And I think a lot of times we have the capacity to relieve ourselves of stress if we have the help and assistance from professionals like Dr. Stanford.
Well, as we're reflecting on this conversation and winding down here, I'm reminded that this is a different kind of freedom fight, right? Because
That's
living
right.
with obesity is a chronic disease. It impacts every part of the body. It impacts a lot of other diseases. And so as we take a look at Black folks who tend to be disproportionately impacted by so many of these diseases, this is something that has to be a priority and something that we approach with urgency.
But
Dr.
just let me quickly say that
Yes.
when we fight for freedom, when we fight against white supremacy, I think we understand that.
Mm-hmm.
But I don't think we completely understand that we also have to fight for self-preservation, for self-development, for self-wellness. We have to have that same adrenaline to protect ourselves, to make ourselves well as we do going up against the forces of racism. Because one of the things that racism does, it makes you have a lower value of your own self-worth. And what we have to do is to elevate our understanding of our own self-worth and then do everything, as Malcolm would say, by any means necessary, protect our health.
Yeah, this is the kind of self-care that's not optional.
Right.
It is key to our very survival. Well, I just want to thank you both for making the time and space today to share your experiences, both life and learned, with all of us here today. Dr. Fatima Cody Stanford, and of course, the legendary Dr. Ben Chavis. Thank you for your contributions, not just to this conversation, but for all that you deposit into the national conversation on wellness, on justice. And we are so grateful for your time today. And we want to thank all of you who joined us for this awesome discussion, really insightful and enlightening in all ways. Also, I should say that I hope that you've learned something that you will take with you and pay it forward and share with someone else, as Dr. Chavis and Dr. Stanford have so brilliantly articulated. Let me also say the options that we're sharing with you through the Black Women's Health Imperative are options that will help extend a full and healthy life. And that's what this is about too. So on behalf of the Black Women's Health Imperative and Healthy Women, and of course our sponsor, Novo Nordisk, we thank you for being part of the Reclaim Your Wellness program, the Reclaim Your Wellness campaign. We want you to visit reclaimyourwellness.org, sign up to be notified of future events with more caring conversations like the ones we've had today. And please, again, share this webinar with your family and friends. Have a great day, a great weekend, and a healthy one.